The implant puncher is used to gently remove mucous membrane prior to an implantation. In the image, you see an implant puncher. During an operation, it's normally mounted to a handpiece. Here you see an illustration showing you the function of the puncher. The puncher is specific in that it only removes enough mucous membrane to cover the width of the implant. Now you see the puncher in operation. The patient has no teeth in the upper jaw and doesn't feel comfortable with the palate of this full prosthesis. In order to spare him the palate part, 2 implants are placed. As you can see, this is done with the punching method. Fortunately, cutting and stitching are not always necessary during an implantation. After punching, the bone is processed using a series of special drills. And finally, the implant is placed. If you'd like to know more, check out the video called Implantation. In this case, ball anchors are screwed onto the implants to hold the prosthesis in place. Thus, a plastic pallet is not required because the suction effect of the prosthesis is no longer necessary for holding it in place. Such minimally invasive operations greatly increase the wearing comfort of full prostheses. In addition, thanks to the punching method, the operation is possible for almost any patient due to its low impact. Unfortunately, punching is not always useful. Our gums consist of a movable layer known as gingiva libera and a solidly attached layer, or gingiva fixa. After the loss of a tooth, the gingiva fixa often recedes, and sometimes only a thin strip is left. There is some evidence that in cases where the gingiva fixa is missing, more plaque develops on the implant tooth on the side facing the tongue. So it follows that a good bond between the gingiva fixa and the implant is of great significance for the durability of the implant. In general, there is more gingiva fixa present in the upper jaw than in the lower jaw. So in most cases, punching can be performed in the upper jaw. It's different in the lower jaw. So if there is not enough gingiva fixa prior to an implantation, punching should not be performed because the puncher removes the gingiva fixa completely. In that case, it's better to make a small cut to push the mucous membrane to the side. Hopefully, a strip of solid gingiva remains on each side of the implant, resulting in much better stability. It's very important that these instruments, as well as all surgical tools, are used in a sterile manner. Here you see a surgical container. The surgical tools are neatly arranged side by side and thus ideally placed for the sterilization process. Prior to surgery, the container is opened and the surgical tools can be taken out with sterile gloves. Thus, the sterility chain is maintained. The use of surgical containers is standard in hospitals, but unfortunately not in all medical practices. If you are to undergo an implantation, bone augmentation surgery, or an intervention of a different kind, be sure to pay special attention to hygiene. Sterile instruments are not the rule. Complicated wound infections and bone infections could be the result. You can find out more in the videos entitled Sterility, Disposable Drapes, and Osteomyelitis.